So today we're going to talk about how paranasal sinus disease could produce an optic neuropathy. And as you know, there are different sinuses, and you got the ones that you're familiar with: the maxillary sinus, the frontal sinus, ethmoid sinus, and then the sphenoid sinus, which is inside of your head. And that's the one where the neurosurgeons can do transsphenoidal and get to the sella, transsphenoidal. So you're familiar with this concept that the sinuses can get access to the intracranial cavity. And the one that causes the optic neuropathy is usually the posterior ethmoid or the sphenoid sinus. And so if you look at the coronal section of the head, if just medial to the anterior clinoid is where the optic nerve is. And just inferior to that is the sphenoid sinus. And so when we have disease in the sphenoid sinus, fungal sinusitis or bacterial sinusitis, it can get contiguous inflammatory or infectious access to the optic canal, which is just medial to the anterior clinoid intracranially, and therefore they can get an ipsilateral optic neuropathy. And you actually don't have to have a break in this bone. It could just pass through the normal passages that exist, or there might be a pre-existing dehiscence in the optic canal that allows the sphenoid sinus direct access to the optic canal. So anytime you have sphenoid sinusitis or posterior ethmoid sinusitis, you got to think about contiguous ipsilateral optic neuropathy. And that means we need a combination of MRI and CT. The CT is going to give us a better look at the bone, including looking for dehiscence of the canal or a direct pathway for occlusive vasculitis, contiguous inflammatory or infectious routes to the canal. And the canal is a very bad place to get inflammation because it's a tight space. And so a small amount of edema in the canal can cause no light perception vision very quickly because it's a compartment syndrome. And that means decompression is necessary, surgical decompression. Now, of course, we're going to give antibiotics, and you could even give steroids once you have control of the organism, as long as it's not fungal. But really, you got to clean out the sinus. In the ethmoid sinus, so you get the posterior ethmoid here, posterior ethmoid. Sometimes people have this aerated extra posterior ethmoid, and that thing is called an Onati cell. So if you got a mucocele in the Onati cell, it can get direct access into the orbital apex. So both the posterior ethmoid and the sphenoid sinus have direct contiguous access to the optic nerve in the canal and in the intra-orbital component in the posterior orbital apex. And so you need to know a little bit about some of these sinuses in terms of optic neuropathy: ethmoid, Onati, and sphenoid.